Okay. So actually, let's start with IVC first, because he's not that important. I'll say that, please. So here we are in the liver. Bring my focus down. A little bit dark, so I might do my 2D up a little bit. So if I go to, I'm pointing towards my patient's left side. So there's my aorta. See the heart up here, we've got liver. This is a bunch of stuff you don't have to worry about yet. And then as I move towards my patient's right side, a little bit of kidney in here, and then I've got that IVC. So our IVC image for our right upper quadrant and abdomen protocols, I want to show it emptying into the right atrium, sweeping for pathology, making sure there's no masses, thrombus, tumor, that kind of stuff. And then we're just going to take a representative image. So there's our one image. So now we're at AOP. So this will be part of your first protocol, the AAA. So you'll notice it's angled. So how do I get this horizontal? So if I push the front of my transducer down, it gets horizontal, but then I lose it. So I'm going to have to go all the way up on that sternum. So when I push forward, it becomes horizontal, and I can see it under the liver. Maybe a little less depth on this bad boy. Go ahead and breathe. You'll notice with that pulsatility, let me rewind a little bit, see how it widens with systole? So I usually want to measure at systole when it's the widest, just to give them the worst case scenario. So there's my image, calipers, outer to outer. So I'm going to lay this caliper right on this outer wall, put this caliper beneath that wall, and sometimes these walls can be a little bit indistinct, and so I'm going to find a place where I can see the walls very clearly, A to P. And we're going to do 90 degrees because, you know, that's how cool we are. So there's our caliper image. Now we want some color. So Doppler color button. Okay, so my machine setting is at 13. It's saying, hey, dum-dum, we need a faster velocity than this. So it kind of has that aliasing going on, plus I'm getting all this tissue movement. So I'm going to go scale up. 43, looking pretty good. Maybe we'll go one more. There we go. So we've got nice color fill with our vessel. And this would be the time if we're seeing any kind of turbulence or anything like that we want to investigate and see what's going on. We've got nice color fill, so there's our color image. And now we're going to go to transverse. Oh, geez, apparently. Now for this, so here we are in transverse. There's a unique thing that happens at this more proximal portion of the aorta, and it's called mirror image. And so sometimes you'll actually get two aortas next to each other. It's physics. We'll talk about it later. So you just have to adjust your little scan maybe a little bit more inferior on the patient. We want to make sure that so here's pancreas, SMA. So if we're SMA, we're in the mid. So we want to make sure we're above that SMA. And then we can go image width. And then we're a little bit dark, so we might just increase our TGCs. Go ahead and try to use that liver as a window when we can. You can see how the walls on the transverse are not as distinct as they are in sagittal. Okay, he's looking rough. Okay, go ahead and breathe. Okay, still looking rough. Come on, buddy. There he goes. Okay, so we've got our transverse, AO prox, caliper. We're going to do outer to outer. Sometimes these walls aren't very clear, so you just have to kind of like pretend that's where the caliper goes, you know. So we'll do that. So width caliper, outer to outer. Okay, so where do I go next? You got it, Sag AO mid. So here we are, we've got this SMA. Sometimes we can't see this SMA, so I usually use the pancreas as a good landmark if you can't find the SMA. I'm going to get rid of some of my depth. That's another thing. Sometimes when you get rid of depth, see how bright things get? So the volume isn't there. So like if I have a lot of depth, it will attenuate my beam. It will make it so that my volume goes away. But when you reduce your depth, sometimes your images can get bright. So not just depth, but think about depth, 2D TGCs at the same time. Okay, let's find this bad boy. Now, how am I going to get this thing horizontal? What's my little hand going to do? Okay, so here it is. So I want less distance between the aorta and my probe. So I'm going to push forward on my probe. Oh, it disappeared. So I'm going to slide superiorly on my patient. We've got pancreas right here. We're elongated out. Oh, it's not looking. We're elongated out as long as we can get. Go and breathe. And we're going to open it up to systole. Take our sag image, calipers. What am I going to do with calipers? Outer to outer. So we're going to put this little caliper right on the outside of that vessel. Okay, what's next on my list? Doppler, you got it. So we want angle for Doppler, so I don't have to push forward to get horizontal. Here, I'm going to show you what happens. So if I'm horizontal, see how it gives me 2? It's like, oh, we're going towards the transducer. Wait, we're going away. So we gotta get really good color fill. So we're going to angle this guy a little bit. Get our representative color image. And now what? Transfers. You got it. TRV. AO. M. You got it. So image width, decreasing my image width. A little bit of depth out of here. 2D down, just a hair. Pushing on my patient. Are you dying? Okay, good news. All right, we're going to do our calipers. We're going to do a width caliper. Outer to outer. IBC is going to be in the liver. Here, let me back up a little bit. So see how round he is? IBC is going to be a little bit more swimmy. See how he's like almost triangular?
Oh, okay, yeah.
Yeah. And you'll just know because you're following it, and it's that pulsatile. Get that clean pulsatility. Okay, where to next? Distal. You got it. Okay, so we're gonna go all the way down. See how this looks like an old lady finger? I'm an old lady. It looks like a finger. And then we're gonna have a little bit of a tapering at those iliacs where the bifurcation is. So I want to center more the actual distal portion. We're gonna look at the iliacs themselves. Maybe a little less depth. Maybe a little bit of 2D down. Sweeping through for pathology and taking our image. So calipers, outer to outer. Now we're going to do our color image. So this is where things get a little bit goofy. So the aorta has a nice angle, and then when they hit the iliacs, and the iliacs actually, at their bifurcation, they stop. They kind of stop being anterior and they start going to the posterior, more retroperitoneal. And so it's okay for your distal if you want it to be blue. Does that make sense? Whatever you want is fine with me. We're just looking for color fill. So I think it actually looks better than blue. So there's our sag aorta distal. Who's next on my list? You got it. All right, so here we are. We're going to end up with our little frog face here in a second. So we're going down to that distal, and then we see how it kind of ends up a little bit wider. And now we have her iliacs right in here. So 1, 2, so right and left. So going back up, there are bifurcations, a little bit more oblong looking at the aorta. So we're going to go back up towards nice and round for the distal and take our measurement. Okay, who's next on my list? Yes. So these can be a little bit tough for you guys because you're new. So they're bifurcating like this. And so what I'll do is sometimes just sit on the distal with the superior portion of my probe and fan across. Other times I might have to come out kind of more laterally and say like, oh, the first one I see on my screen is going to be the left. Or if I'm going this direction, the first one I see on my screen is going to be the right. So it just kind of depends how your patients are. But let's see what we got here. Okay, so the bottom of my transducer is towards her left side. So I know this is going to be my left iliac. Now I have the bottom of the transducer towards my right side, so this is going to be right. Belly buttons give us trouble. They're like big black holes. So we might have to come laterally to the umbilicus and then angle back. And then if I want to get really crazy, we have that coronal view. So that's me like, remember that one, the extracardiac one? So I'm actually scanning kind of sideways through her. So then since I'm scanning from her right side over, this is going to be the right iliac, this is going to be the left iliac.
So would you change the
Nah.
That's your current one?
Maybe, yes, maybe.
Maybe,
Yeah.
yeah.
Yes, it is. No, nah. They don't really care too much. Okay, so back in action. Let's get that right iliac. You're just so easy to scan. So I'm scanning from the right over, so this more anterior one is going to be my right iliac. Caliper, caliper. We love calipers. Can't get enough. And what's next for my sag right? Color. Yep, you got it. And again, if these are blue or red, I don't care. It doesn't matter to me. Where'd that bad boy go? Oh, we have both of them. Look how beautiful that is. Okay. Now we're going to go into sag left just because we're here and ignore the transverse real quick. So we're going to go, I'm going to start on the left side, scanning back over. Oh, that's a nice iliac. Look at your iliacs. Great job with your iliacs. So in this case, I'm scanning from the left over, so if I did see that second iliac, I know the left is going to be the one that's in the more interior of my image, and the right is going to be further away. Get our calipers on it. We've already done color, we'll do it again, but we've already done color, but we can do one more. We got kind of both of them at once. Okay, so we ignored our transverses, and we're going to do them together. You don't have to do this, but she just scanned so easily that it was easy to see. So this is that frog face. So here we are, spinal process, aorta distal. We're going to go down until we get two little frog eyes right in here. Oop, belly button trouble. And there we have our frog eyes. So in this case, we can get both of these together. Sometimes you can't. Sometimes one of them moves out like maybe a little laterally, so it's oblique. So hers are just perfectly aligned. And so we're going to get both of these together. Other times you might have to image them independently of each other. There's our little frog face. Get our calipers, outer to outer. Oh, button. And that's the end of our protocol. Looking skeptical. Okay, all right, okay. All right, I'm gonna leave you gooped up if that's okay.